Great.
3, 2, 1. Welcome to the SaaS Pulse Show. My name is Michael Bertoni, and I'm the founder and CEO of SaaS Talent. And unbelievably excited today, everybody. We have a cutting edge AI based platform here, revenue positive, he likes to mention, and a great founder, co founder. His name is Nathan Peereboom. He is the co-founder and CEO of JotPsych. He's building a product called SmartScribe. Basically, this is a revenue positive AI startup that reduces behavioral health medical charting by 90%. Pretty compelling, man. So great to have you on the show.
Thanks, Michael. Great to be here.
Yeah, whenever you say reduces something by 90%, it's like, that's like the lead magnet right there. It's beautiful. I'm looking forward to learning more about what it is. But Nathan, always love to get started with the superhero backstory. You kind of look like a little superhero-ish, with the hair and the look and the headphones. So love the superhero backstory because I'm a big Superman fan. How did you come to JotPsych, right? So what was the journey that led you to JotPsych and this company that you look like you've been building for a little over a year and a half?
Yeah, well, I definitely don't think of myself as any kind of superhero, but I do appreciate that. The superheroes in my life were honestly my mom and dad. They are medical professionals. My mom's a nurse practitioner, my dad's a neuro-oncologist. And medicine is, for many reasons, a really challenging field right now. One of the things that makes it particularly challenging is that providers spend an enormous amount of time producing narrative documentation. And there are historical reasons for that, mostly driven by the advent of electronic health records.
Mm-hmm.
And, just the kind of litigious environment we're in, as well as a cultural value on data collection and data analysis. So there are a lot of reasons why documentation is just very big in a medical person's life right now. But I saw them, going through this process where they'd spend, 8-10 hours at work, and then they'd have, 2 hours, 4 hours of charting afterwards.
Oh,
And it was just crazy. So JotPsych has a really simple mission. We take all of the narrative part of the documentation process away from you. So you walk into your client or your patient's encounter, you click record, you record it, you click done, and you get a fully structured note. Now, that note is tailored to your template and your preferences in terms of formatting, styling, and content sensitivity. But it is ultimately a pre-built note for you, so you don't have to go through that writing process from
nice.
scratch every single time.
Saving time, right? Saving time for your parents, saving time. Love that story. He saw pain with his parents. His parents can't spend time with me. They're always at work. They're doing all this stuff, right? I want my parents to come home, right? So he builds a software company. So seriously, everybody, I could just tell by Nathan speaking Rockstar Central here. So love this. So tell us about this product, right? So behavioral health medical charting, right? Tell us about this product. Give us the elevator pitch, right? You talked about it a little bit, the elevator pitch and the value proposition.
Yeah, the value proposition is, right now, if you're working in behavioral health, you're spending 2 to 4 hours every single day writing your chart. We reduce that by 90%. The chart you get
Wow.
is more accurate and more thorough than what you could get with a human scribe at this point. And it's something that, costs $150 a month. So you can save, 40, 60 hours a month for the cost of essentially $150.
Wow. So tell me where you are in your journey right now. So I saw on LinkedIn you're about a year and a half, right? So give me that background of launch,
Yeah,
right? Revenue positive, right? I mean, so revenue positive AI startup. Love that, right? Just to say that out of the gate. So where are you with the product, right? When did you launch? And I guess you're already making some money. So tell me about that story.
sure. So we started out really just talking to clinicians and asking if they would let us shadow them. And what we found really quickly was that it was really easy for us to find research partners. We spent the first 3 months traveling around the United States, living in clinical offices, going to visits with patients, watching what happens in the room, then looking over the shoulder of the particular physician or nurse practitioner who writes the chart. We built our technology that way. In the middle to late part of last summer, so summer 2023, we had around 100 people using the software, and we said, we think it's probably time to charge for it. So when we charged, what we found was that everyone kind of fell away except behavioral health practitioners. And one of the pieces of advice I would give to other startup founders is, understand that there's a big difference between revealed and expressed preferences. And price is one of the best ways to unreveal a preference, and or pardon me, to reveal a preference. Right. And so what that pricing did was it gave us a real focus area. It helped us really hone in on behavioral health. And so that's exactly what we did. We built over 40 different modules specifically for the niche behavioral health practices that we were serving, spanning, TMS, Spravato, ketamine treatment, traditional, addiction medicine, or, anxiety and depression care, as well as therapy. And what that enabled us to do was to build a software that all of a sudden became best in class for behavioral health, because a lot of the other AI scribes in the space were trying to build more generalized software, particularly for primary care, which is a larger market. From that point, we grew incredibly rapidly. We still are growing around, 10 to 30% month over month. We're going to cross $1 million ARR probably in the next month or two. And so we've been lucky enough to do a tiny bit of fundraising, some hiring, but in every moment we try and bring ourselves back to the core of the business, which is the product. And that becomes increasingly exciting the more people that are on it and the more feedback you get. But yeah, right now, over 2,000 people have tried the software. And we're just like super excited about the way it's going to change behavioral health.
This is the way a startup is supposed to operate right here. When you say startup and get off the ground, I love it. So tell me about, for the people listening, people might not understand behavioral health, like what that is, but so just let's dig into the ICP. I always like to do that, your customer. So for people listening, behavioral health, like what is that and who are you actually selling to? Because the thing I love to hear is when somebody reaches out to you and they're like, oh, I got a lead from the show.
Yeah.
So what's a behavioral? So what is that ICP? Who are you selling to and how can we help you?
So the target customer, so to speak, well, first I'll just define behavioral health. We think about behavioral health pretty broadly. And the line between behavioral health and just non-behavioral health is increasingly fuzzy the more we learn about neurobiology and the more we understand, particularly about pharmacological, interventions into behavioral health. On one side, I would say you have, therapy, so you have social workers, therapists, folks who are, working with research-based techniques to help individuals work through and process and grow in particular, areas that comprise kind of the mental health sphere.
Sure.
As you move kind of towards the more medical or clinical version of that, you kind of cross into like psychology, which is very like assessment based. And then you get into like psychiatry, and, medication, treatment for addiction and things like that. And then you get into neurology, which is kind of the furthest kind of towards the clinical side. I think of that as pain medicine. Palliative medicine is kind of in that sphere as well. But we kind of think about behavioral medicine as any subspecialty that has to do with, or cares about like psychosocial and behavioral elements of a patient's experience. So that's kind of the target specialty. The actual clinics and the providers we serve tend to be kind of mid-size. So we don't, try and serve large health systems. Large health systems have, a lot of regulatory onerous, bureaucracy in them. They're really hard for startups to work with. And, I think everyone knows this, but the lifeblood of a startup is fast iteration. You need to get your product out. You need to get feedback, good or bad, and it needs to happen really, really fast. That's pretty much the only competitive advantage you have early on compared to other, resource-rich competitors. And so we decided fairly early on not to pursue the hospital route, despite the fact that there are obviously like huge, amounts of dollars in that market. But we
Yeah.
said to ourselves, if we can serve single shingle practitioners, clinics with just several, facilities rather than, whole entire, surgery centers, oncology centers, and, all of that, then we'll actually be able to make the best product in the market. And ultimately, we believe that in the long run, moving up market is only going to happen if we have the best product. And so again, like that's our North Star in everything that we do.
Yeah, I love it. I mean, I tell this story to every startup I talk to. I mean, Salesforce for years literally sold to like a couple
Mm,
people CRM. Like now they're the biggest enterprise company in the world, one of the biggest. But they just were SMB, like no software, SMB. That was their pitch way
yeah.
back in the day. So yeah, I think it's a great, I mean, start small, get into a market that can spend a little bit, right? And then go from there. And I mean, it sounds kind of going into my next question here, really exciting. It sounds like you build a product, right? You got it to market, you hit a sweet spot, right? And you started growing. So now I want to understand the challenges, right? So it's you've grown pretty rapidly. So the last year and a half for a lot of startups has been hard, right? It's been a hard year and a half. You've done well. So what have been the major challenges that you've dealt with even to this day, and how are you overcoming them?
Yeah. Everything is a problem. I mean, that's the thing that people don't tell you. I mean, it's true. It's true that, I guess on paper, things look like they're going well.
Yeah.
But every single day I get out of bed, I mean, I'm excited to like work on this project, but there is also an element of me that knows the one part of the business that is like broken. And that's where I
Mm,
spend all my time.
love it.
I
You should.
like the thing that I mean, I'm kind of parroting Elon Musk a little bit here, but he says, one of the pains of being like, a CEO is that you're only focused on the thing that's going poorly. If something's going well, you should be spending basically zero time there, because what that means is that someone else is doing a great job with it and it's humming, and it's not the constraint in the business. We think about our business as a constraint problem, almost like a thermodynamic constraint problem. And so there's always one thing that is like basically holding the whole thing back. Right now, I would say one of the real challenges is, just seeing the market shift really quickly and
Mm,
balancing the instinct to fundraise or not to fundraise, to scale or not to scale.
sure.
When Jackson Bierfeld is my co-founder, and he gets 100% of the credit for everything that we've basically built up to this point, along with the rest of the engineering team. But one of the things that we said at the beginning was, we don't need to be $1 billion company. We can build a small business here, and we can build something that's really high quality for a small number of people. That has gotten more complicated as, AI scribes have commoditized, and so we've kind of shifted our vision to becoming a behavioral health EHR, like a
Mm,
zero keystroke
mm,
EHR, in which you're not doing, you as the clinician are not filling out e-prescriptions, lab orders, appointments, referral letters, etc. All of that is pre-generated, and it's a single touch approval. That vision is larger, and it's something that is kind of mandated by the nature of the market.
mm,
But it's also something that's forced us to come to the table and say, you know what, if we're going to build something that is, maybe 10x in complexity, to the software that we have right now, we have this question of, how do we fundraise? Do we fundraise? What's the balance between holding on to that core business that we have right now and building into what we think is going to be a long run success?
right.
And so that tension, particularly when it comes to acquiring engineering talent, which I think, is something that about probably far more than I do, is like a constant question. And it's a constant existential question. It's a constant philosophical question. It spans more than just like the business itself. It spans like us as human beings and what we're trying to do, like with our brief time on Earth. And so I would say that is like one area that is like a constant, discussion point. The other thing I would say is, one of the things that changes when you scale is you move from having very personal relationships with customers
Mm,
to realizing that a lot of your customers you've never met. I mean, for the
right.
first 4 months, I knew personally every single customer, and they had my cell phone, and they would call me and I would call them. And like, it was a real relationship. And those folks, we still have that. And that has made everything, a lot easier in terms of serving them. When you scale, you start to realize there are customers who you don't even really understand. They're like kind of a different, they're 2 layers away, they're 2 shells away from the target customer that you've been serving. And so one of the disciplines that you have to keep bringing yourself back to is how much time you allocate between the hyper local personal relationship building and on the ground work with customers, and also that necessary work of building up an organization and scaling and thinking about just the analytical side of things like digital ads or marketing or the way that a sales pipeline works. And so that tension between what you really want, which is like a super on the ground in the trenches relationship with the people who have the problem you're trying to solve, and then that other side of you that wants to build something that has scale and is therefore a little bit more abstracted from the customer, that tension is something you're always battling. And you have to kind of keep like kind of moving the tiller back and forth. There are weeks where I need to be all in, in the clinics, talking to customers, doing really nothing else, not worried about scale. And then there are other times where the constraint in the business is not that we don't understand something about the customer, but it's that our Google Ads account got suspended and we have to haggle with with Google about that. So
Right.
it just depends what the problem is, but there are these tensions that arise, and the resolution of those tensions is the composition of good decision making.
No, that's great. I mean, and this kind of brings me into my next question. It's been a great interview. You're in an offsite right now, so people, right? So what are important things for you? And I'm sure you've got some awesome stuff to this too. People, talent acquisition, right? So how do you look at that? Like, what's important to you there?
Yeah. Yeah, so as you mentioned, we're at an offsite. We're a remote company, but we really, really believe in human time together. Jax and I are like, we're super close friends. We've been friends for like 10, 15 years. We met in college. We don't want to have some kind of transactional relationship with each other, and we don't want to have a transactional relationship with employees. We want this to feel like a mission-driven company where we're spending 14 hours a day working, but we're also developing deep relationships that will last beyond the exit of the company. I think that there are a few things that I would say that I didn't realize were like super important in early employees and early talent acquisition that I'll just like point out. The first thing I would say is knowing the right thing to focus on is the most important skill in an early employee. There's so many rabbit holes you can run down, and that happens. Like, you end up spending 2 days on something and you're like, oh my gosh, that was a zero. That came to nothing.
Right.
No, having folks who have a lot of insight is just super important. It's kind of unfortunate because it does kind of boil down to like how much information they can take in, how insightful they are about negotiating that information, how much pattern recognition they have, how much exposure to startup, kind of philosophy they have. So that's kind of a one thing. The second thing is you really don't have time to manage people. You want people who come in, see the problem, are completely aligned in like the large vision, but you don't want to be having an employee-employer relationship with your early team members.
Yeah.
And one of the weird things about that is that you can get this weird like inversion process where sometimes people who have been absolute rock stars in large companies are really not ideal for like a startup system. And sometimes people with no experience, like interns, for example, are absolute dynamite because they don't have that, hierarchical idea of like, oh, I wait for a task to be given to me, then I accomplish the task and I do it really well. But like, there's this like kind of task management process. Sometimes you like take an intern who's just super eager and you give them a broad space that they need to solve. And 2 days later, they come back and it's messy and it works. And that's kind of what you need. You need messy, you need it to work, you need to be fast. And that's very, very different than when you work in a blue chip company. It's not entirely different. I mean, obviously, like everyone's their own individual and, kind of flexes along that scale. But those are two really important things. I would also say that just like being resourceful is really important. And, that's a funny quality because there are certain things you're allowed to do in a startup that you're not really allowed to do in a large company. And if you get used to governing yourself based on those principles, you can get trapped into a corner. I'll give you an example. So back in May, we our Google Ads account got suspended, and we had no
Right.
idea why. And there were two like sub vendors that were kind of like managing the policy for Google. It was just a mess, and it was going on for weeks and weeks and weeks. And eventually, what we decided to do was we couldn't get a hold of anyone at Google because they basically subcontract the way that they administer their policy. And so we literally like emailed every single US employee at Google Ads. Like if you're a US employee at Google Ads, you've gotten an email from me. I know I'm never going to get hired at Google Ads because I've basically spammed that whole, department.
Love that.
But that's something that if you're at
Yeah, I
like a
do.
larger company, it's really, really hard to like take on that kind of social friction. But in a small company, if it's existential, you kind of have to. And so there are a lot of moments like that where you need someone's brain to click into, okay, no matter what, this has to work. And I'm willing to kind of do anything to make it work. And
Yeah.
that's a little bit of that's just a mindset that some people have and some people don't.
Yeah. So when we work with our clients, there's a startup mindset that you have to have. And what's really cool, you can maybe take this as proactive. So the person has to constantly be proactive. So that means they're bringing you ideas. That means you're bringing you things to do. That means they're trying different things. It's okay. Where I learned this was where I had my best years of my career. I used to come to my boss every day and I bring him ideas. Like every day I bring him ideas. He'd be like, oh, that one's bad. That one's bad. But do that. Right. I did it every day. And it's just a little bit of moving needle every time, just doing that. But no, I totally get it. That person's hard to find sometimes. So this has been a great interview. So last question, advice, right? So for the people listening, like solopreneurs that might want to start a startup, other startup founders that are listening to this right now, what are the two or three biggest piece of advice that you would give them?
Yeah. The first piece of advice I would give, and I'm pulling this a little bit from like a retrospective that we did as a team about 2 months ago, because we sat down and we kind of asked ourselves this question too. The first thing I would say is the canon of startup advice is really good. Like Y Combinator has this podcast called Startup School. It's the best resource I've ever come across.
Unbelievable.
It's correct in every single, like, I've not had any experience starting a startup where I thought about that podcast, which I've listened to like 3 times at this point.
Yeah.
And I mean, it's a whole series, and it's right. It's correct. There's pattern recognition there. Follow that canon. The second thing I would say is be very weary of the kind of fundraise fast, put out a vision without a product culture of startups. There is a lot of that. And there's a path to victory in that world where you raise a lot of money, you have an idea, you swing it correct, and it works. And for some people, that actually is a good path because it's professionally de-risking. It's something where, people have the understanding that things are, that you've done something that other people, again, with pattern recognition in the form of venture capitalists, find valuable. Jackson and I very early on decided that we wanted to be a company that was really rooted in substance. We only really cared about like revenue and product. We were not interested in fundraising until like it became existentially necessary based on just like the way that our revenue cycle works and like what we needed to spend to continue to grow. And I think that really served us well. And I think it's in the bones of our company. So I would just say, like, if you're thinking about starting a startup and your first question is, how do I fundraise? That's probably the wrong question.
Yes.
And unless you have product, it's hard for me to think about a non-hardware startup in which you can't find product market fit without raising money. And when I say raising money, I don't mean like, a few, less than $100,000, just to cover your living expenses. I'm talking about like, you're going and raising several $100,000. You're diluting your cap table. You're doing all this stuff that, you're posting on LinkedIn that you raised money. If your first idea is like, I'll put, I'm going to raise a lot and then figure out like what product I'm building. I just think that that's not the right decision.
Yeah.
But again, that's like based on my own experience and philosophy. And there have been plenty of companies who have done that super well. And, I'm happy for them.
Nathan, you're right on, right? So all I do is work with tech startups, right? There is like a there's like a bootstrapping tidal wave. Like there's so many companies that are service companies or companies making money that are like basically I would say 50% of the podcasts I'm doing, I have a service company. I build a software product.
Mm-hmm.
And they're bootstrapping it, right?
Yeah.
So many more companies are bootstrapping. So everybody listening, it's great advice. Build your product, get some customers, hack it together. Doesn't have to be perfect, right? Make some money, right? You don't have to get funding. So I'm totally with you. We are so aligned. But Nathan, it's been a great show, man. It's been awesome. I'm looking forward to following your career. So again, it's Nathan Peereboom, behavioral health companies, right? If you know any, reach out to them. If you need startup advice, obviously in clinical, definitely reach out to them. And it's awesome having you on the show. Let's debrief for a couple minutes, but I'm looking forward to following your journey.
Michael, thanks for having me on. Appreciate it.